Hey, good morning, everybody. Welcome here. I hope you can hear me okay. Tom, it's good to see you. Tom, you're going to appreciate this. I'm here in Texas. I'm in Fort Worth. Just got here day before yesterday, and you can consider yourself lucky, dear Thomas, because you're in California. Got here last night, and we had tornadoes in Fort Worth, and woke up this morning to snow. I'm looking outside my hotel room, and there's snow all over outside. So I don't imagine that you missed that. Anyway, great to have you, Tom, and I look forward to connecting with you back in the Golden Bear State. Okay, Jason, you're with us too. That's great to see you. Jason is my partner in arms. Tom, I think you know Jason, vice versa. Anyway, great to have both you guys here. We'll wait for a few more to join in here, and we'll dive in. Let's see. Yeah, I've got a way to kind of track this one. That's great. Let's give it just a minute or more before we get started up here. Okay, I want to get a couple more people online here, but I'm happy to have you guys here with us. Still kind of stunned by it, Tom. During the night, we had the curtains open and the rain. They had, what do they call it? You'll know this, a straight line wind. I think that's what it is, where the wind is going sideways. It's so powerful, and it was blowing the rain against the window of our hotel room here, and had the window open, and so the light from the outside, including lightning, kept showing up with trees, the outline, the silhouette of trees against the wall. It was actually quite beautiful. I really enjoyed it. It wasn't unnerving to me, so I'm grateful for that. So I got a good night's rest, even though there were tornadoes in the vicinity. I know that these storms down here are really serious. I understand that there's been some damage actually in Louisiana, so I'm grateful to have been spared that. Well, why don't I go ahead and dive in? And I know that we're going to record these events, and people that aren't able to catch the very beginning can catch it later on. I'm happy to have Tom and Jason with us, and I'll welcome other people as they join in. Tom and Jason, just for you to know, we've formally launched the Vitality Project just this past week on January 1st, and we've got 20 members signed on in this first week. So we're really pleased with having people join the forces here. We'll be talking about the value of community, including in this particular online group support system that we're in the midst of creating with the Vitality Project, and I'm glad to have both you guys involved with me in this. I'm also going to announce, and I'll come back to it, is that Jason has just, my partner is Jason Reno, and Jason has just put up an information page for any of you that are interested in membership information. If you want to join with the 20 of us that have already joined in here, you'll find more information at the link that Jason's put up there. There's also a special New Year's offer that makes joining in almost impossible to, what is it? We're going to make you an offer you can't refuse. It's almost impossible to refuse the offer. It has such low cost and we hope high value. And Tom, you're writing me that you're going to see 60 degrees today in Orange County. Oh, you dadgum whippersnapper, you. I don't think we'll be seeing 60 degrees here in sunny downtown Fort Worth. It's actually, the sun has actually come out. For anybody that joins us now or later, he smiles back. I want to invite comments and questions as we kind of proceed forward here today. We've got a good 25 minutes together. Oh, thanks. Jason just put up the actual special incentive New Year's offer here, $1 for the first 30 days of membership, and then $49 a month for afterwards. If you sign up now, that's half the price of the ongoing membership. So it's the dollar incentive is hard to beat, and the $49 is, as one person put it, a great bargain. She said it was a steal. So at any rate, hope the people will be interested in joining us here. I'm going to invite any comments or questions you guys have as we dive in. I think what I want to do is start by just reviewing something that we touched on the other day, and then move into some other issues. Jason, you've helped to publicize this, that we're interested in our Facebook Live events of tackling sometimes topics that are not uncontroversial. There's a lot of publicity right now about addiction treatment, particularly in light of the nationwide opioid crisis. And I just had breakfast this morning with my what would he be? My he's my daughter's half brother. So whatever you call him, I was with him. He works for a pharmaceutical company here in Fort Worth. It was very interesting comparing notes with him, talking about his awareness. He's a chemist by background. His awareness of the opioid crisis. It's ubiquitous. It's everywhere you turn in the news. There's discussion of this, and rightly so. I think I heard this morning. There's nearly 100 deaths a day in the United States just to the opioid epidemic. But I wanted to say something. We're wanting to cast a broad net here at the Vitality Project. And for any of you who view this video later, I hope that this lands favorably for you. What we mean by that is we mean for the Vitality Project to be inclusive, not only of individuals who are in recovery from active addiction to substances, but also for all the rest of us who, in addition to that, are enslaved to habits that are habits that we can't stop and that they're harmful to us in some way. And as we've talked about before, 25% of Americans over the age of 12 are currently clinically addicted to substance. And those substances include alcohol, nicotine, and then all the other psychoactive drugs, including the opioids. That's 25%, 1 out of 4. That's 80 million Americans are currently clinically addicted. So it's a massive segment of our population. It's a huge cost, both personally as well as financially, to the nation. It's an incredibly expensive process of what's going on, and it's a nationwide scourge. And so that's 25% of Americans. There was a national study done. How many Americans would identify themselves as currently being addicted to behaviors outside of addiction to alcohol and other drugs? 90% of Americans say they have at least one behavioral addiction right now. And those behavioral addictions include anything from compulsive gambling, compulsive sex, including porn, compulsive online video gaming, social media addiction, compulsive shopping, compulsive eating, anything that we feel compelled to do. In other words, we can't stop it, and it ends up causing us harm either to ourselves physically, in terms of our own personal health, to our relationships, or to our capacity to work and to contribute. All of these are considered addictions, and 90% of Americans say right now that they currently have at least one behavioral addiction. So it's just to say that we're really talking about the Vitality Project would be recovery for everyone. There's no one who's excluded. And if we think about it, what are we talking about recovering? Well, we're talking about recovering that which is now enslaved. The term addiction comes from the Latin root of the word for slave. That word is addictus. That simply means slave in Latin. So we're talking about either being addicted to substances or habits and other behaviors, even attitudes that are really counterproductive or destructive for us right now. So we're looking at liberating ourselves from this kind of enslavement. And the way I think of recovery is that what we're wanting to recover is our true and full potential, our ability to contribute in meaningful ways in our lives, to be the best self that we can be. I think about this often. I'd like to be the best Bob Weathers I can possibly be. And then there's high incentive, high motivation to want to recover from anything that would keep my potential locked in the basement, locked behind bars, under the rock. I want to release all of that. And that's how I think of recovery. And so in that sense, it's meant to be seen as recovery as a universal phenomenon, just as addiction or enslavement is universal. 2/3 of Americans right now say they have at least one family member who's currently clinically addicted to substance. 2 out of 3. That seems high, except if you think about it, 1 out of 4 Americans is clinically addicted. It stands to reason if you're in a family of 4, you're going to have somebody in your family, at least one person, who's addicted. And the sad part is that 2 out of 3 in that same study, 2 out of 3 of Americans won't talk to anybody outside the family about addiction going on inside their immediate family. And why is that? Well, there's just so much incredible shame, which is feeling awful about it ourselves if we're addicted, and also stigma from society towards addiction. So none of us want to admit it ourselves if we're in need of recovery from addiction, nor do we want to even admit it if we have somebody in our family who's addicted, because there's so much negative judgment. So what we're trying to do here at the Vitality Project is pull addiction out of the shadows into a conversation where we can speak about it rationally, compassionately, where we can introduce the latest scientific information that can help us kind of keep a level head, as well as point in the direction of what might be effective in terms of treating our addictions. All of this we're committed to here at the Vitality Project. So as an introduction, that kind of lays out where we're headed here with the Vitality Project. I want to welcome Tammy. It's wonderful to have you with us, Tammy. Thank you for joining us. Want to kind of set the tone for these Facebook Live meetings. We'll be having them each Wednesday and Saturday, Wednesday afternoons and Saturday mornings over the next several weeks. We'll be having these, you can count on these. And one of the things that Jason and I, my partner, have wanted to establish is that we're interested in looking at topics that people don't typically talk about in addiction recovery. And so there's plenty of controversy around treatment. There's plenty of controversy around really what addiction is. And we hope to unpack that in a humane and caring and hopefully intelligent way over these next several conversations. I invite any of you, Tammy, you're welcome, Tom, Jason, anybody else who joins us, you're welcome to write in comments or questions as they come up for you as we're here together. I wanted to tackle 2 limitations today in our time together. It's brief, and we'll introduce these, and we may take a deeper dive in future conversations, but I want to take a look at 2 profound limitations, in my view, in current models of treatment of addiction. The first one is simple enough to explain, and there's a lot here, and we'll touch on it today. We'll introduce it today. The first limitation is something I run into every day of my work week. I work 100% in addiction recovery right now, and as I mentioned in our first introductory session this last week, I lead 14 groups a week at 8 different treatment centers in Southern Orange County. And so that constitutes the bulk of my work right now locally. I also work out of my office with my wife, Colleen. We both see clients, and I work exclusively with clients as recovery coaches. So I see individual clients, sometimes couples, sometimes families in my local office here in Irvine. And then plus a fair bit of my work is done like we're doing right now. It's online, where I end up being involved in recovery coaching with clients, in this case, across the planet. So I have clients in Europe, South Africa, South America, Australia. It's really quite extraordinary what's possible with online technology, including our being able to be here together today. And so I run into certain questions that come up often for me in my work. And this is the first question, or the first limitation that came to my mind this week as I was pondering today's Facebook Live event. And that is, it has to do with post-treatment follow-up. How do you follow through on treatment? Here in Southern California, well, actually I'm in Texas right now, but when I'm in Southern California, we have clients come from all over the United States to Southern California. There's a concentration of treatment centers in Southern California, including in Orange County, where I live. Clients will come from all over the country. They'll come typically for a 30-day stay. That's typically what their insurance will provide for. Many of them have profound experiences, profound transformative experiences, at the very least in their behavior. At the end of 30 days, this may be the first 30 days that they've been clean and sober from their various addictive substances in a very long time. I work a lot with treating severe addiction. So these are people that have been addicted to heroin and other opiates, and or methamphetamine and other stimulants. And we do get people that have been addicted to alcohol and other substances, but these are severe addictions. So people will have a break in the clouds, and they'll actually be clean and sober for the first time in a long spell. the problem is that they're oftentimes released from treatment, and this is kind of the model of insurance reimbursement that we have. Many of them are released at the end of 30 days and sent back home, and not surprisingly, many of them, in fact, I want to say most of them, relapse within a short period of time. I was reading a statistic yesterday. In fact, I want to include a link to an article for you all. Let me just bring this link up. I'm going to put it right here in our chat section. Well, let me get the right article. Excuse me. Here's the, yeah, there it is right there. Okay. There's a Time Magazine puts out these special issues, and you see these in the grocery store, and I love them. The Science of Happiness was a recent one, and it included all of the recent research in psychology and medicine and other disciplines, sociology, looking at what goes into making us happy, fulfilled in our lives. Well, there's a brand new one that just came out about a month ago or so, and it's out now, called The Science of Addiction. I highly recommend that everyone purchase this. Let's see, I'm hoping that this will show up in our comments, and if it doesn't, I'll find a way to link it to you. Let's try one more time. Let's see, how do I get this to go? Did it go? Well, now you have two instances of it. It did go. I just didn't see that. I put a link here to how you can purchase this. It's the special Time issue is available in hard copy. You can get it in a magazine. I have it in that, and I also have downloaded it onto my Kindle, so I can read it online as well. In this article, this is research that is hot off the press. I've been aware of this for some time, and it's a very dismal finding. Is that only 10% of people that go into treatment are sober from their addictive drug at the end of a year. And that's even optimistic. So the statistics typically are somewhere between 5 and 10% a year follow-up continue to be sober. And you think about that, and that's just not acceptable. What's summarized in this brand new issue, and I'm really encouraged by this, I intend to delve deeper into this, is those people that are able to continue some form of treatment beyond, let's say, a 30-day stint in rehab. The success rates go up to 60% at the end of a year. I have the chills right now of that. From 10% to 60%. So you can see why I wanted to touch on this one is the lack of follow-up. The brevity of treatment. Most medical models that I'm aware of recommend for the brain to heal. In fact, this is summarized also in this Time issue. For the brain to heal sufficiently for somebody to develop clarity of mind and resources, kind of a foundation biologically, that requires typically a minimum of 90 days. And it would be the rare insurance company that would provide treatment, and most people can't afford to pay for treatment. Even the most modestly kind of rated treatment programs are beyond what people can afford, and so we need to look at this. I think just strictly from an economic level, our models are not sufficient for providing the kind of treatment that people need. But even after, let's say that you have the advantage of 90 days of treatment, the idea of, I think most of us think, well, now I'm fixed, right? Especially the loved ones of those that have been addicted to substance. And they come home and they face the stresses of work, the stresses of reacclimating to the home environment, especially in the wake of severe addiction and all of the betrayals of trust and disappointments that have gone on. And people understandably will relapse. The number one trigger for relapse in addictions of any kind is stress. And so it stands to reason that if you were to provide support for people once they leave more intensive outpatient treatment and provide sustained support, that you could get something as profound as a increase from 10% success rate to 60% success rate. That is monumental. When you think about the numbers we're talking about, 80 million Americans are currently addicted to substance. Only 10% of those ever get treatment for their addiction. And out of that 10% that get treatment, only 10% are sober at the end of a year. You realize we've got a massive problem that needs to be addressed with more imagination and much more ambitiously than has happened so far. So I'll say a word about this, is that one of my investments, this is actually what spurred my enthusiasm about the Vitality Project is just my awareness that it's not okay for people to leave treatment here in Southern California, be sent home with the recommendation that they find a self-help support group, most often a 12-step support group, and a sponsor if they can, and good luck with that. I think that does work for a very small percentage of people. The success rates, while they've not been nailed down because of the anonymity, for example, of the 12-step program, the success rates are very similar, 5 to 10% at the end of a year. And what that means is that people need more support. And I'll say more about this as a second limitation in just a couple of minutes, but they need more support than just a self-help support group. Many of them need medical advice, problem solving about psychological, emotional, relational stressors, etc. And the 12-step support program, while valuable, is very partial, and it's just not sufficient. And so we need more. We don't need to exclude the 12 steps. We need to include more with the 12 steps. So the Vitality Project is meant to supply much of this. It's meant to supply community in terms of weekly multiple meetings a week, group meetings, a buddy system where buddies meet regularly during the week, ongoing problem solving, my bringing late breaking information from research, just like what I'm sharing today, via daily video and blog posts. This is every day, every morning, rolling out of bed with Dr. Bob. And the goal there is to keep people informed about what's coming out that could be helpful, that could give them a leg up on recovery. And plus we provide a 24/7 discussion forum. It's a safe, fully confidential support group, and it's meant to provide what's missing right now for so many people. They leave intensive support in an inpatient setting, let's say, and go home to virtually nothing like that. It's just not enough. And so where this is meant to provide a bridge to people reacclimating into their home environments. I want to recommend, and I'm going to put a link up here to a TED Talk I just viewed this morning that talks about how it is that isolation fuels addiction. Give me just a second, we'll bring it up here. And I highly recommend this TED Talk, really valuable. This is by the neuroscientist Rachel Wertzman, and I'm really moved by this. And while I'm thinking of it, let me put the link to another TED Talk that has gone viral. This is Johan Hari. Many of you have seen this. His TED Talk is simply called well, I'll have to send it to you so I can see the title of it. Everything you think about addiction treatment, or something like that. Let's see. Everything, it's coming up. Everything you think you know about addiction is wrong. That's Johan Hari. He's an incredible journalist from the UK, and he's comes from Swiss heritage, hence his name. He's written a book called Chasing the Scream that is an incredible book. This video is really worth watching and rewatching if you've seen it before. The final line of the video is, the opposite of addiction is not sobriety, it's connection. And so whether you see Johan Hari's video and or Rachel Wertzman's, they're putting their finger on one of the major problems right now in addiction treatment, which is the lack of community, the lack of connection post-treatment. And I'm very invested personally in this, and this is the whole brainchild behind the Vitality Project. Let me mention just briefly a second major limitation, and we'll be expanding on this for sure in the Vitality Project. We're already discussing this in the Vitality Project in our weekly group meetings, as well as my daily video posts, but we'll be discussing it also in these Facebook Live events. It's what I call the siloization within addiction treatment, just the idea of separate silos. And so you get a lot of language used. You can go online right now and look up addiction treatment and look up any rehab center, and virtually everyone, I guarantee you, will use the word holistic treatment in their verbiage, in their advertising. The problem isn't the language. The problem is where the rubber meets the road, and the actual reality is anything but holistic. I'll give you 3 examples of it. One of them cuts very close to home for me. The first one has to do with spirituality. If you take a spirituality only focus. If you put the spirituality silo and you say, this is what we're going to focus treatment on, is that the risk of that, and this happens a lot in self-help support groups, and I hate to say it, but the 12-step support groups can commit this error if they're not careful, is that they'll ignore medication advances in the last 10 to 20 years that are extraordinary in terms of treating so-called dual diagnoses. There's medications for treating anxiety disorders, treating PTSD, post-traumatic stress disorder, treating depression, treating other disorders, attention deficit disorder, things that correlate highly with addictive behaviors, including addiction to substance, and those mustn't be ignored. Also, I think that there's an ignorance about addiction research. For example, in the last 20 to 30 years, almost everything we know about addiction has come out of the research that's been done with brain scan technology, and that wasn't available. I started graduate school 40 years ago, and I can guarantee you there weren't the brain scans that were available to do the research. And so what I studied in graduate school was soon eclipsed by the advances in medical technology and research technology. And then finally, something that's missing, I think, if you take a spirituality only focus in terms of addiction treatment, is that you miss out, and this is in my domain, you miss out in contributions in the last 30, 40 years of psychological research. For example, looking at research studies into what's referred to as human attachment, how we connect to each other socially, or also the whole subdiscipline within psychology of the treatment of severe emotional trauma. Virtually all of that has come out since I graduated from graduate school 30 years ago. So all of that needs to be included. I've busted the spirituality only perspective. I feel the same way towards the psychology or therapy only perspective, and that cuts very close to my own training, is that many therapists unfortunately ignore biological factors. My wife Colleen is a therapist, and I've spent 40 years of my career as a clinical psychologist and now a recovery coach, is that many of us are ignorant of the medical or the biological dimensions of addiction. And for example, one of the practical ways that shows up is that most therapists don't understand that in the first year of addiction recovery, when somebody is in what is referred to as post-acute withdrawal syndrome, there are profound limitations on doing psychotherapy in any kind of conventional form. You've got to be informed about how long it takes for addiction to pass through the brain and for the brain to restabilize, where emotional processing and also working through relationship issues, it's not even possible in the early months of treatment, and there's plenty of therapists that are ignorant of that fact. And then finally, I come from a family of people that were medical. My father was a physician and a psychiatrist. There's an error that can happen there, is you'll get a medical perspective that looks at everything as only medical and will ignore or minimize the social and the psychological context of addiction. It's easy to do that when you have a pill or an assessment tool that's medical, because it can be very powerful, but not to ignore the fact that the fact is that we're all three of these things. We're all physical medical bodies that value biomedical intervention. We all have minds, which means we have emotions, we have relationships, that's the realm of psychology, and we all have a spiritual self. We all have a need for spiritual resources, value and meaning and purpose, and that integrating all three of these is at the very least what's required for doing adequate treatment of addiction in any form, whether it's addiction to substance or addiction to behavior, is that we have to have an inclusive model. And most often, way too often, one or more of these perspectives will be missing at the expense of focusing on just one alone. So I hope you understand, as I sketched that out, that we require a body, mind, spirit holism, and it can't just be in words. I'll say this as we wrap up just for today, and I'd be interested in any further comments as you review this and think about this, is that I'm committed to this personally in terms of my own recovery from severe addiction. And I'm also committed to this professionally in terms of the work I do right now, is that it's critical that we hold all of these perspectives as crucial. Every one of them matters. Working on the physical body, health, medically, in terms of personal practices is vital. Working on our relationships, working on our emotional life, working on our mental health, not dispensable. And the very same thing that we're working with what matters most to us in terms of our spiritual selves. And so all of them are necessary, and any treatment that excludes any of them is certainly not sufficient. So to summarize then, two major limitations right now that we'll summarize today, and we'll come back and talk about others. Two major limitations within addiction treatment, as I see it, is insufficient follow-through on inpatient treatment, where the prevailing model is not adequate. It's not adequate in terms of the time given for treatment, and it's really not adequate in terms of post-treatment follow-through, in terms of social, emotional, spiritual support, and medical support. They're just not sufficient treatment. And then secondly, the breaking into separate silos of the treatment, and the lack of seeming realization that we are not separated from any of these, that we're all bodies, minds, and spirits simultaneously. So any treatment that's worth its name has got to address all of those. So that's a little bit to bite off and chew on for today. I want to thank all of you for joining us. Really appreciate your participation today. Review this, send me comments. You can follow our schedule for upcoming Facebook Live events at the Vitality Project Facebook page. It's a public page, and we have a scheduling for next Wednesday and next Saturday, the scheduling for our next events next week and over the next several weeks. Would love to have you guys come and join, and bring your friends. Please feel to write any comments you have to me on that public Facebook page, and I will respond to you personally. And invite your friends as well to join us in our next event, which will be next Wednesday. I wish everybody a wonderful weekend. I wish you Godspeed. Thanks for joining today. I'll see you next week. Take care. Bye-bye for now.